All righty. I'd like to welcome everybody to this episode of Them Smith Boys. We definitely have a good episode, a serious topic today. We're going to be talking about, well, first of all, I'm one of your hosts. I'm Anthony Smith. And then I'll pass it on to my brother.
Hey, look, I'm James Smith, AKA Junior, AKA Dr. Jeopardy, AKA, Humble Savage.
So yeah, we have a kind of a serious topic today. We know that life has definitely changed with the COVID pandemic, and it definitely changed a lot of people's lives. It changed a lot of people's bodies, and it changed a lot of people's minds. And so today we're going to talk about wellness. We're going to talk about mental health, and we're going to talk about the impact that COVID-19 has had on people who struggle or new struggles. We have two excellent guests, Dr. Carter and Dr. Buckingham. We're going to bring them on soon. But I think my brother wants to make a little announcement before we get started.
Oh yeah, well, just in our first episode, we talked about the Rocky Run community, the village that we grew up in. Before we transitioned to Trent Court. And, I'd like to offer condolences because the Rocky Run Village there in New Bern, North Carolina, outside New Bern, North Carolina, is kind of hurting right now with the loss of a couple of dear people. The Fisher family lost their daughter, Kim. We grew up with them in the Rocky Run Church. I graduated with her brother, Kilmore, back in 1990, but I remember that family very well. So our condolences on the loss of that family. Condolences to the McDaniel family on the loss of Lisa. she was one of those people in the village as well that we grew up with, and we went down there, rode the bus, went to school with, part of the village. So condolences to the McDaniel family.
And I'm sorry, Lisa McDaniel, we graduated together. So she was she was one of my high school classmates. And I tell you, it does touch home, because I guess it makes you, I didn't mean to cut you off, but I just wanted to put
No,
it
you're
out
fine, you're
there.
fine, you're fine, yeah.
When people that you know, people that you grew up with, once they start to pass away with this virus, it does start to, I'm not sure if it happened because of the virus, but it does start to hit home, and it does start to make you think about your own mortality. Go ahead.
Yeah, definitely. Excellent point. Last but not least, condolences to the Henderson family on the loss of Miss Val. Miss Val, we told her that story about when that night we moved to Trent Court, that first night.
Mm-hmm.
It was actually Miss Val that gave us the ride. Yeah. All of us packed up in that. I don't know how we got in that little. I think it was a white Datsun. I think. All of us packed. It was me, you, Mama, Aunt, Joanne, Pam, and her two daughters, Aquanetta and Shawana. Yeah. So the two girls. So condolences to the family, to the Harrington family, and you're definitely in our prayers.
Yeah.
Thank you.
So, Jimmy, tell me. We've been talking about this topic, and we've been going around looking at statistics. What was your thought process coming into this program, especially with the topic that we're about to talk about?
Well, you know me, man. You know the perspective I come from, and when I look at stats and look at numbers, they're concerning. But I have this thing. Every stat has a story, right? Every stat has a story. And behind those stats, what are the dynamics in place that are causing those stats to be more prevalent when one group over the other?
Yeah.
And when you go into socioeconomics, like I think they say when the flu hits, when America catch the cold, African American catch the flu. So whatever ails the main society, it really ails African Americans.
Yeah.
So socioeconomics is not just a broad issue with the country, but it impacts us disproportionately.
Yeah.
And socioeconomics does impact, health. Can you afford healthy food, things of that nature? Do you have a type of job that allows you to get sick leave, to get off, and things of that nature? So when I looked at those numbers, I automatically went into what are the dynamics that have caused those numbers to be true. And I know when the excellent guests come on, I know they would definitely add a little substance to what we're talking about.
Yeah, I mean that's a really good point. The dynamics in the background that oftentimes does tell a story, but I think you would agree that in most cases that this is something that we can control. We can control, for the most part, we can control what we eat, and we can control how much physical activity that we have.
We can. Like you said, we can control those things. And like you said, everybody has a choice, right? Everybody has a choice, but your choice is only good as your options. Right?
Hold on. Hold on. Let's rewind that. Yeah. That is a very good point.
I mean, just case in point, like me and Chan, we eating healthy, we're trying to do right and get weight off and things of that nature. And we go to the store, and a pound of hamburger costs $10. Lean hamburgers, $10. To that person that makes $10 an hour, So that's what socioeconomics does limit your choices. So like I said, but stats have a story, and I understand, what you said about the eating right and being healthy. Those are crucial things. But like you said, options go with choices.
That is true. That is true.
Yes,
and then oftentimes, I know one of the one of the television shows that's very intriguing to me is My 600-Pound Life. And then one of the things that there seems to always be sort of like a mental health component to it. And and I think you can say that there's a mental health component to most things. But the question is, how do we there is a stigma associated with mental health, even particularly in the African American community. So that's hopefully one of the things that we can kind of discuss and talk about that mental health component, because that is very important.
Yes, totally agree. Totally agree. Nobody likes to. I guess we, especially as men, we're men, and we're taught to tough it up and suck it in. But all that sucking in when that pressure busts.
Yeah. So do you have anything else before I bring on our guest?
No, man, I'm ready to get into these experts, man. I'm excited to see them, see what they got to say and everything.
All right, let's see. Let's give us 1 second more. All righty. Welcome.
Hey, Joe.
Let's see. Well, Dr. Carter, I think you're on first. While we're getting Dr. Buckingham on, let's go ahead and let's give a brief introduction and let's talk a little bit about your history.
Okay. So I am Dr. Cedrina Calder, also known as FitDoc. I'm a board certified preventive medicine physician, health and wellness expert, and fitness pro. I actually currently serve as a medical director within the public health sector. And I also do a lot of work in areas of health and wellness. I frequently do a lot of different interviews in media, as well as write articles and things of that nature. My focus is really mostly on women's health and helping them to understand how they can improve their health through lifestyle changes. So anything that has to do with weight loss, nutrition, prevention of chronic disease, those are my focuses, really. And that is my focus as a preventive medicine physician as well. We really focus on trying to prevent disease and disability and prevent the progression of disease rather than just treating disease. Yeah. So while I have seen patients and treated them like a normal physician would, I also look at that prevention aspect, which is very important. And I look at not just the health of an individual, also pay attention to the health of the community, right? So that's a lot of what I do as far when I'm working as a medical director within the public health sector. That focus is more so on the community, on individuals as well, but really looking at the health of the public as a whole.
Well, thank you. Thank you for the introduction. Thank you for being on. Dr. Buckingham, you can go ahead and introduce yourself, please.
Hey, them Smith boys. Thanks for having me. I'm glad to be here. So, Dr. Buckingham, I am a licensed clinical psychotherapist. I've been in the field for about 24 years, and I've worked in every aspect of mental health, from substance abuse to individual therapy to child adolescents. I mean, you name it, I've kind of like done it in the mental health space. Started off my training in the Air Force, where I met one of these Smith boys, Anthony Smith. We were stationed together at Tyndall Air Force Base in the early, late 90s. And so I have an opportunity to provide mental health service across the world, Germany, Turkey, all different places. And currently I serve as a consultant in my own business, Buckingham Consultant Group, where we provide consulting to organizations on leadership development, cultural diversity, and those things. I also provide counseling to individuals, a lot of marriage therapy. And lastly, I'm an IFC, International Coaching Federation certified. I provide a lot of coaching, executive coaching, life coaching, and those things in my consultant business. And lastly, I have a not-for-profit called the Empathy and Resiliency Center, where I provide donation-based services to African Americans, military members, and veterans. And I have rightfully earned the nickname of the ER doctor, the Empathy and Resiliency Doctor. And so glad to be here.
Okay.
All right.
So look,
And
so
let me-
I have to put this out there. The first time I met Dr. Buckingham was in the gym at Tunda Air Force Base. And I tell you, I crossed him over so bad on that basketball court.
Hey, who won?
Okay, you won.
Yeah,
Okay.
Yeah.
Hey,
All right.
Dr. Buckingham,
Yes,
I
sir.
think you left one thing out, man.
What was that?
I saw in your bio that you're a captain.
Oh yeah. You know,
Well, you need to leave that out. Just
yeah, I guess you probably made the wrong choice. So for all of you all out there to know, I'm one of those pretty boys. So we don't call them noobs. And thank you for the introduction. I'm an author too. Just I left that out. I've published 14 books as well and 4 documentaries. And got a new book coming out, Created to Win, Conditioned to Lose. So thank you for reminding me of the achievements of the noobs, the cows. Yeah.
Okay. So look, Dr. Carter,
nice
we're gonna start off with you, and I have a question for you. Can you kind of explain BMI, because there seems to be a lot of I know this is one of the questions I was going to ask you, but can you BMI, that seems to be a very controversial kind of subject depending on who you're talking to. So could you just kind of explain BMI and how that contributes to the way that you classify the weight classes?
Oh, sure. So BMI stands for Body Mass Index. It's a calculation where they use your height and your weight to come up with a number. And then with the numbers, they have different categories. They have underweight, normal weight, and then they have overweight, and then they have obese. And then within the obese category, there are actually different levels of obesity. Yeah. So what they use the BMI for is to try to assess, it's supposed to be an assessment of how much body fat you have. It's like kind of like a quick way of trying to assess how fat someone is, I guess. I don't want to say how fat, but how much body fat they have. Yeah. Because we know that when you're overweight and you're obese, you're actually at risk for a lot of different chronic medical conditions. So it's an important measurement to try to get. The only problem with it is that in certain individuals, it may not be accurate. So depending on your muscle mass, that really will affect the BMI. So for B, I have a lot of muscle mass for an average woman. So my BMI is going to look higher, whereas I don't have that much body fat. So it can overestimate your BMI, your how much body fat you really have, or it can be an underestimation as well. So if you see that a lot in older individuals who start to lose muscle mass, the BMI will actually make them look like they are less fat, if that makes sense. Okay.
So yes, it makes sense. Mm-hmm. Since COVID-19 has started, have you seen a increase, or have there been any conditions that has been exacerbated because of the COVID-19 epidemic?
I would say definitely. I mean, some of the things I've seen as a preventive medicine physician in working in public health, a lot of people stopped getting their screenings because of the pandemic. And then when things kind of open back up, they may not have come back on time or didn't come back to get the screenings. So now you find people who are diagnosed with different types of cancers in later stages because they missed some of those important screenings. So I think that's one thing that we have seen because of the pandemic. And that, that's not really associated with, your weight per se, but that's one of the things that was affected by the pandemic. As far as anything else, I think, I don't really think there was anything else that really comes to mind other than, we saw people who were overweight. They were suffering with COVID more. They were having more severe forms of COVID. They were ending up in hospitals. They were ending up on ventilators. And then a lot of times they were the people that were more likely to unfortunately pass away, right? So those were some of the issues we're seeing with COVID when it comes to weight.
Okay. All right. Listen, I have a question. What role do you think socioeconomics play and the high obesity rates. Now, I know we mentioned earlier in our when me and my brother were a little going back and forth, I mentioned that when when the society, overall society has an issue, it impacts Afro-Americans at a disproportionate rate. And that's true with socioeconomics. And I want to know, what role do you think socioeconomics play in the high obesity rates within our community?
Oh, yeah. So, yeah, it definitely plays a very significant role for a number of reasons. One of the areas that plays a role in is like, for example, so in people who are have lower education, which is not to say that all Black Americans or whatever are not as educated, but because of different reasons, systemic race, I can name a number of reasons why, but there are groups of African Americans who may be less educated for whatever reason, and that it has been associated with having poor health outcomes because of just not having that knowledge of what you're supposed to do to try to prevent certain things, and how to just better take care of yourself, how to have better habits. Then another reason would be access to healthy food. So if you live in certain areas, your access to food, you may not have the same access to food as someone who lives in an affluent area. You're not going to have places where you can go and get healthy food. You're going to have all the fast food restaurants, though, all the corner stores, all the places that sell food that are denser in calories and lower in nutrients. So that leads to weight gain. So that's one of the big issues that you see that affect people in the Black community. Another issue I would say would be, so like I said, the access to food, access to areas to exercise. Maybe you live in a community that's not safe and you can't really get outside like that to walk around. You don't have maybe you don't even have sidewalks. I mean, that's a big issue in certain areas, lack of sidewalks. I mean, people don't really see that as a big thing sometimes, but you need a sidewalk to walk on, right? So to walk safely on the street. So if you don't have things like sidewalks or parks or places where you could go and just move around, move your body, you don't have access to a gym. There's no gym nearby where you live, or you may not even be able to afford a gym membership. So these are some of the things that certain people may not have access to. And because of that, you're gonna probably gain more weight than someone else who has access to that.
Okay. Can I
and then there's some
speak?
cultural things as well. Certain foods that we like to eat sometimes will contribute to weight gain. And so all of those, it's just a number of things. It's definitely not one thing. It's a number of reasons why we seem to be more susceptible to being overweight and being obese. And these are not all things that we can control ourselves, right? Some of it, yes, we do have some control over some of it, but some of these things we can't control. And those socioeconomic factors, a lot of times, are things that we don't really have direct control over. You can't really control the area where you were born or who, what type of information you were provided. And then these things are passed on from, one person to the next in the family. So if your family everyone's obese in your family, most likely you're going to be obese too. Some of it can be genetic. There's a slight genetic component, but a lot of it is behavioral as well. So if no one taught you how to properly eat, then how would you know how to properly eat? How are you going to teach your children how to properly eat? So
yeah, that's an excellent point. Me and my brother, we were talking, and I was talking about when I had my checkups and everything. And a few years back, my doctor was like, James, you're on the borderline where your numbers are starting to, if you'll make some changes. And I thought to myself, okay, I was able to, when I took time off work, I had the type of job where I don't lose pay when I go off, right? And then when they said, oh, you need to see a nutritionist, I take that leave, my paycheck is not impacted. Yeah. And then when the nutritionist gave me that list of expensive food I had to eat, I went to the grocery store and was able to pick out the healthier things. Now, with the socioeconomic, some people, when they have jobs, they don't have jobs where, like mom had, Aunt, when you you
Yeah.
take time off, you just don't get paid.
Yeah.
So, but that's just not us. Okay, that's the broader community, broader society as well. But I know it impacts us a little differently. Okay.
Exactly.
Go ahead, Dr. Buckingham.
Yeah, I mean, everything that Dr. Carr, I mean, she's obviously the expert in the area, right on point. She hit all of the different factors from cultural to everything. And so I think, for me, when I think about socioeconomic status, I often, and obesity, people are what they eat. And what they eat is a reflection of what's in their pocket, which ties to finances. And so she's using the word access. And so why do we have limited access to certain things? As she had mentioned, it can be culture, it can be psychological. A big part of it is financially. If you just look at our history as well, not saying that a lot of African Americans, again, are not educated and doing well financially, but people typically eat what they can afford. And I grew up eating what we can afford. So obesity is obviously the socioeconomic factor that was big in my life was finances. My mother, we born in poverty. So you're going to eat what's available to you. Part of our cultural history, as she mentioned, traditionally, the kind of foods, pork and pig and all the stuff that was readily available to you, that's an access issue. What do you have access to? And so her key word was access, which it resonated in my soul because that is what I've seen in a lot of people who come from backgrounds like me, and strictly poverty. So.
Yeah, when we lived in Trent Court, and it was a Piggly Wiggly right there on Broad Street, and the Piggly Wiggly uptown.
Yeah.
The meats, the meats in the Piggly Wiggly over there between Trent Court and Craven Terrace.
Yeah.
Boy.
Yeah.
See, I'll leave it at that.
Yeah. Definitely. You're definitely right about that. Junior, did you have a question for Dr. Buckingham?
Oh yeah, sure. Dr. Buckingham, why do you think they're dealing with mental health issues and things of that nature? Why do you think there's such a stigma within our community as far as reaching out to get help, to talk to somebody about issues that we may have? Why do you think that's such a big issue with us?
Well, I'll speak from two perspectives, one personal, then one professionally. The personal side of the house is, I think in our community, we struggle with understanding and balancing theology and psychology. So the theology part is we're taught to pray and have faith. And so a person's dealing with depression, go pray about it. God's going to deliver you. And so that faith issue is tied to our raising, and that's how we got through slavery and every other major traumatic cultural experience was through theology/prayer. So then now all of a sudden you take a people who built a foundation on that and you want them to access mental health through psychology. It's a foreign land. And so the stigma associated with that, why would I actually pray for something or, about a mental health issue? And that's because that's what I know. And so coming to talk to someone like me is not commonplace. People do what's common to them. Prayer is extremely common in our culture, in our communities. So pray as opposed to get help. That stigma of going to talk to someone like me labels you as crazy. And unfortunately, when you go to get help, it should be the last thing that you're called is crazy, because crazy people do the same thing over expecting different results. So if you're distressed and you get help, we label them crazy. And the people who are broken and stay broken, we say they okay. Problem.
That's a lot to unpack right
I'm trying to digest that. That's a lot to unpack. Look.
It's rare that you get both them and Smith Boy speechless.
Yeah.
Wow.
Theology.
Those are some great points.
Theology and psychology are different. They're both ologies, but they come from different places. When we start with theology, we start from a place of what God can do. And then we come from psychology. We are more about empowering the individual. So if we put our faith in God, it makes us passive. When we put our work into psychology, we become active in our mental health. See, prayer can cause you to be very passive and pray about it. And I don't necessarily have to do a lot. In psychology, I'm going to force you to work. We're going to develop some skills, some behaviors. We're going to attack the mindset. And so the last thing about this is I think when we teach in our community, theology is rooted in teaching people about the soul. Now, the Greek word for soul is psyche. So this is why you have people in our community are broken and they live in church, because you're nurturing their reverence, but you're not nurturing their soul, which is the psyche.
What's a whole nother show, boy? Good grace, that's a whole nother show.
Yeah.
So how do you break through that mindset? I mean, because
Yeah.
it's hard to change a mindset.
It is. Great question. And I mentioned the word balance, right? Balancing theology with psychology, because if you go into people with something that they're not familiar with, they're going to rebel. So one of the things that I kind of did in my non-for-profit is I started to integrate by putting mental health professionals in the church settings, because that's where people are most comfortable. So you have to meet people where they're at. Is when you begin to break down and shift the mindset. You can't come at a person and tell them where they need to be if they're mentally not ready to be there. So one of the things is you have to start where they're at. You can't shift a mind until the person is ready to shift.
Mm.
Yeah, I was thinking, when we think back and we look back, like when we left our home and had to move into Trent Court, we probably needed counseling. When we think about the trauma, right? Even my shadows, even the process when Dad passed away, having to go to all of the chemotherapy sessions and being there at the end and afterwards is over. But in retrospect, it wasn't over, and I definitely, in retrospect, know I would have came out a whole lot better if I would have reached out and talked to somebody instead of kept the ball up inside. So to your point, you say, you can just suck it up, you're not feeling good, you're not want to get out of bed, just suck it up. When in reality, I was probably going through some type of mental episode and didn't realize it. So to your point, you sit there and pray that it'll go away. You pray to take the pain away, pain, joy for a night, joy come in the morning, that thing, and joy wasn't coming in the morning. It took a lot of mornings. So to your point, I know exactly what you're talking about, sir.
So my sister, she just posted a comment, and I'm gonna read this. And actually, as I read this, I'm just thinking back to even when I was in middle school, and it says that we also have to realize that mental health struggles in children are oftentimes punished, especially for Black youth, because it's often seen as misbehavior and not evidence of anxiety and depression.
Amen to that. I mean, that's my story. I had a speech impediment, and instead of people addressing the speech impediment, which was causing me anxiety, I got disciplined physically for acting out. So to her point, that's exactly our problem. No one took the time to say, okay, why is Dr. Buckingham having these issues mentally? Because they were more focused on disciplining me and keeping me in order. So the mental health issue doesn't get addressed. To her point, even in childhood.
Yeah, and as a teacher, and I teach at an alternative school, I can tell you that is 100% correct. When people don't understand issues that the children are going through at home in their communities, and it becomes a referral slip, and then it becomes you push out and it goes to all those dynamics level down the road. That's definitely true.
Yeah.
Dr. Carter, is there ever I guess I can say is there an intersection between your practice and mental health? Some of the patients that you deal with and some of the struggles?
Yeah. So I'm not seeing a patient right now, but I was a few months back. But yeah, a lot of my patients would come in with some type of mental health disorder, and a lot of anxiety, a lot of depression. Those were the top two that I saw mostly in my patient population, because I'm in public health, the uninsured. So you can imagine what kind of issues they had on top of the mental health issues. They already, they had financially, they just were strapped. They didn't really have much money at all. And the area where I'm at, where I work, is actually in a rural area of Tennessee. So they just had a ton of other issues that they were dealing with, social issues. So mental health was definitely a common thing that I dealt with. And, I prescribed some medications And then I refer out as well. Obviously, I always refer for therapy, but there are times where I will treat depending on how bad it is and what it is. But that's a big thing. And I even saw definitely some younger patients, and I would try to really target like especially the younger Black men that I would come across, ones that I knew were dealing with some stuff, and try to convince them to go see someone, go get a therapist. And I would share, I go to therapy, and I tell everybody that. And I would try to share that with them, like this doesn't mean you're crazy. It's really not a big deal. Trust me, it's helpful. You want to talk to people that know what they're doing, who's trained to kind of talk with you and help you work things out in your mind. Because sometimes it would say, well, I'll talk to my friends. And I'm like, no. I was like, it's not the same. Like, you need to talk to somebody, a third party, who is trained, who can actually help you try to walk through some of these things that you're dealing with. So I think super important as medical professionals, as Black people, anyone, just to be advocates for mental health and do it publicly. I promote it. I talk about it. I have not always been in therapy. I actually just started last year, and I don't know why I waited so long. But I promote it. I advocate for it. And I definitely think that more people should do it, especially within our community. And it's just going to take more of us pushing that narrative that there's nothing wrong with going to therapy, and that it's helpful, and that we all should honestly believe that everyone should be in therapy, no matter what is going on, whether you think you're having issues or not. We all have dealt with something in our past that needs to be handled. So so I'm very much a promoter of mental health.
I agree with that. Every therapist should seek therapists, is what I was told. Every therapist should seek therapy. And so just like Dr. Carr, I put up my hands and tell people I'm in therapy. I see a therapist. Say, oh, you've been doing all this work for 24 years. Why do you talk to someone? And I say, because I'm human. So I don't care what kind of initials behind your name, what kind of degrees you have. There's not a human being who hasn't walked this earth who hasn't suffered in some form or fashion. And so if I would be a hypocrite if I did not encourage people to go, but also be willing to go myself. So the Dr. Carr, we can all benefit from it. And even if it's preventative in nature, so you don't always have to go when you're broke down and you can't breathe and your days are too long. An ounce of prevention, you can go to therapy, preventative kind of nature, just to develop the skills that when the adversity hits, you already have the resiliency built up.
Exactly.
One of the things that when I was researching this, the topic for this podcast, one of the things that kept sticking out was the impact that COVID had on children, to include obesity, but more importantly, to include mental health issues. So what advice would you give to parents who may not be able to recognize it, or they're dealing with the stress themselves? What advice would you give to parents out there who are having to cope along with their children?
For me, it would always be when children are coming to place. I mean, it's our natural instinct. I have a 6-year-old and a 3-year-old. And as parents, our natural instinct is always to make sure they're good. But I often like to use the whole airplane analogy, right? Where they say, put on your mask before you put on your child's mask. So in the state of COVID-19, where everybody's stressed and overwhelmed, I think is irrational to believe that you can be the best for your child when you haven't dealt with your own issues. So that is counterintuitive to parents. But because of all the stress that we've been through with COVID-19, I would tell them first to pay attention to how you're feeling and process that before you try to help your child process whatever they're feeling. And you always have to start there. It's counterintuitive because we want to protect externally before we heal internally.
Yeah.
So that's what I'll tell them. Take a deep look at yourself first, figure out how you feel about COVID-19, how it's been impacting you, and try to work through that, and you'll be in a better place to be able to help your kids. I mean, with, kids can't go to graduations, they're homeschooling, our kids sitting on computers all day. If the children are feeling it, you're feeling it too, because you have to be responsible for making sure they're doing everything. So again, focus a little bit on yourself. Self-care is important in order to be able to provide external care. Self-care first, external care after that. It doesn't sound, the way we are taught, but that's the reality. You cannot give what you don't have, not even to your own child. You're delusional if you believe you can give to that child what you don't have.
Dr. Carter, what advice, and I know Dr. Buckingham made an excellent point about your what's in your pocket determines and things, which is very true. But what advice would you give to people who are on the lower income, socioeconomic income spectrum, as far as how would they get healthy snacks or things of that nature, or do things to be more proactive about their health and eating? What advice would you give them?
Yeah, so, well, first I'll start with physical activity. So I think there's a common misconception that you need to belong to a gym to work out, to get, to be active, and it's not true. You can do things in your home. You can walk around. I mean, if you can outside your home, then walk there. If you're at work, try to walk as much as possible, take stairs as much as possible. There are small things that you can do. The key is to sit for as least time as possible. So the more you sit, it's just not good. So you want to be able to move every so often. We shouldn't be sitting for 2 hours straight and not getting up and moving around. So the more you move, the better. So as far as food is concerned, there's certain things that you can do. So you got to kind of work with what you have. Frozen options are available to most people. So if you can't afford fresh fruit and vegetables, there's nothing wrong with buying frozen fruits and vegetables, and they're a lot cheaper. I would even go as far as to say canned fruits and vegetables, if they don't have additional like sugar, salt, those types of things added to it, then those are fine as well. So those are cheaper options. For meats, frozen meats, like some of the pre-cut chicken and all those types of things that are in the freezer section, not like where the regular meat section is. So that might be cheaper for you. You can do that. There's different options. You may not be able to eat as healthy as someone who has better access, but you can still improve on what you're doing currently. Okay. The key is to not eat out so much, because that's where the unhealthy food is. You can't control what's in the food. So the first, probably the primary suggestion I would have is to try to cook your food at home. That would be the first step that you could take, is to cook your own food. In addition, just trying to stay away from a lot of snacks. So not a bunch of chips and cookies and cakes and pies and all that. Focus on eating real food. So if you're
are you talking to me?
Yeah, I'm about to say.
All in my business. You're talking to me personally.
I feel attacked.
Yeah, I'm feeling guilty over here.
So you can buy frozen fish, all that stuff. Frozen fish is cheaper than buying fresh fish, obviously. So those are options that will be cheaper for you. But try to stay away from eating all the packaged foods. Those are cheaper, but they also trashy. The boxed lunches and the frozen meals and entrees and breakfast and all that stuff that they have, those foods they're just not healthy. So
look, I have a question for both of you all. So my sister is a nurse. She lives in Raleigh. She works at Wake Med. Wake Med is probably one of the bigger hospitals in the triangle area. And, so she texts us back and forth, and basically she's overwhelmed. Okay. I think that there have been a couple of providers over the last year or so that have actually committed suicide. So I know that we probably have some healthcare workers that are probably watching or may watch. what advice or what could you tell them, especially if they're dealing with the amount of death that they probably may not be used to? What would you say to them?
I would start off by saying recognize the difference between stress and burnout first and foremost, because there is a difference. You know, good stress, bad stress. You know, stress sometimes can propel us to keep going. Burnout depletes us and overwhelms us. And so the key word is depletion. So when you're at your job and you're doing whatever as a healthcare professional, you're starting to feel depleted. And when you're depleted with this burnout, you start to be cynical and a little bit negative, and you begin. So pay attention to those signs. And then obviously, if I have any recommendation, it's going to be get help. I mean, you know, that, and I'm not talking about go to the break room and sit around and drink coffee with your colleagues and just talk about how long the day is. I'm talking about getting some professional help to help you work through those feelings of burnout, because burnout is not stress. With a little stress, it can keep you propelled. Burnout knocks you off your feet. Okay. And so get some professional help, all mental health, all healthcare, all medical professionals who've been exposed to these extreme conditions in COVID-19.
Good point.
Yes, excellent point.
My advice would be to take time off when you need to. Stop feeling like everyone, you know, I know sometimes as a provider, you just feel like everyone's dependent on you and you need to be there to do X, Y, Z. Without you, who's going to do it? But sometimes you just get to that point where you just need to step away. So, I mean, if you get to the point where you're suffering from burnout to the point where you actually feel like you may harm yourself, that's pretty bad. If you need to quit your job, then you may just have to do that. So you just kind of have to pull away, be willing to be honest with yourself and real with yourself as to what's going on with you, and just speak with whoever you need to let them know that you need time away.
Yeah, that's an excellent point. You know, a lot of people don't know this. My siblings and a couple of my close friends know. Last February, I had a bout with COVID, and it was not a pleasant experience. It was probably one of the worst experiences I've ever gone through. One trip to the hospital, but it was just one trip, so it wasn't as bad as the other outcomes. But one thing I realized that after you did your little 2 weeks, I went back to work too early, trying to go back to work and trying to, you know, be a soldier and stuff. And it actually did more damage. But what I realized, I learned then that when it comes to my mental and physical health, I'm going to take days, because what I saw is that our district, we lost people to COVID. And before the funeral, their job was advertised. So one thing I learned is that if something happens to me, they're going to get together. Oh, Mr. Smith cracked jokes. He was a good guy, whatever. And then they're going to be interviewing for my position. So I learned that I'm going to, in everything, put myself first when it comes to things of mental and physical health. And thanks for reiterating that, Doc. Fit Doc.
That's good. Never allow your passion to cause you to be overwhelmed with pain. I think that's the problem with people in the medical field. We come into it because we're extremely passionate about helping and serving others, but you cannot allow your passion to cause and trigger you pain. Your pain point is a sign that you're overstepping, overdoing, and going outside of your passion boundaries, because it shouldn't hurt you that much if you're passionate about it. So that's an indicator I tell people, that if you're in whatever field you're in, if your passion is starting to cause you a lot of pain, you're in too deep.
One of the comments came in that said that some people can't take time off. And I think we talk a lot about socioeconomic status. Like I said, my brother said he was able to, because of the job that he has, he was able to take time off and still get paid for it. The folks who can't take time off, I mean, that has to be just a tough situation.
Yeah.
Dr. Calder already spoke to it though. And I mean, and what she said, and I'm going to keep using this word access, because when you can't take off from work because of your financial situations, you have to become more resourceful. And resourceful is figuring out strategically, what can I do within my means? just as she spoke to about money tied to food, there's different ways of getting your needs met. And so it may not be that you have the financial luxury to take off, but are you strategically looking for other resources that you can get access to that works within your schedule? So, you have to be solution focused and not problem focused. So if I focus only on my pain and not how to get out of it, that becomes my narrative.
Yeah, I think one thing that happened at the beginning of the pandemic is that the government made certain people essential workers and made people in the service at the meat packing industry, made those essential workers, which means they didn't have access to the unemployment benefits like everybody else had. Yeah. So that's another thing with socioeconomics, how, I hate to say it this way, you're expendable, for lack of a better term. And policy shows that. So just want to put that out there in the atmosphere. Okay.
Yeah, it did. But also, I think at the center of everything we're talking about, in my opinion, is also your mindset. It's also your mindset, right? Because, there's always going to be limitations that's placed on us on some way, form, or fashion. So even if it's, I don't get the same benefits as someone else, then what can I do to cope with that? So I'm going to always bring it back to what we can't control externally, we have to be able to manage internally. Because if not, you're going to lose on both spectrums. You're not getting the benefits someone else is getting, and then you're depressed behind it. So you can't control the benefits and the policies, but how you cope with it, you have to take control over that.
Excellent point.
You're going to lose double time.
Excellent point. Excellent point.
Wow, this is definitely some good conversation, man. Hey, I'm booking a session.
Look, Dr. Buckingham, I'm just going to let you know right now. When I go back and look over this video here, some of your stuff gonna be. I give the Duke some credit. Signals, I give you some credit. We'll take it from you. So I might give you some credits for it. I will. Yeah. But I'm gonna definitely use some of those nuggets. And so, Fit Doc, I'm gonna cut back on the chips because you called me out on Facebook. Yeah. I'm gonna throw the bag out right now. Time we get off.
Yeah. So we're at the 10 minutes to the hour. We like to try to keep this about an hour. So I guess now's the time. Does anybody have any? Well, we'll go at closing comments. So we'll do ladies first. Dr. Carter, you can go ahead and if you have any closing comments.
My closing comment is to put yourself first, as we kind of brought up, and that's by taking care of your mental health and your physical health. So you have to take ownership of yourself. You have to do what you have to do in order to figure out how I can improve my health. So you can't wait for someone to do it for you and to just volunteer the information, go out and try to seek the information for yourself.
Right. All right. So I like to end with quotes, so it gives people something to easily kind of remember. 2 quotes. One, my personal quote is, resilient people find solution in problems. In contrast, troubled people find problems in every solution. So when you're resilient, you're looking for solutions. When you're troubled, you're looking for the problems in the solution. So try to be resilient as possible mentally in your mind. And then the last thing that I would say is that you cannot run from demons in your head because they show up in your life.
Wow. My closing remarks is I enjoyed the conversation. Very impressive individuals here. I love to see this side of our people being on display. And I really appreciate you two taking your time and sharing your knowledge and your wealth of expertise with the people.
Yeah.
Thank you. Okay.
Yeah, and so again, first of all, I want to thank Dr. Carter and Dr. Buckingham for coming on. We have a history, and I do want to give a shout out. Dr. Buckingham just retired. How long you been retired?
Exactly what, 1 month? I mean, 1 September actually. So Friday will be exactly 1 month.
Yeah. 1 September with 06 pay. Can I get a loan? Yeah.
Well, and, give me a loan first.
Yeah. And Dr. Calder, who, congratulations on your engagement. She is engaged to one of my very, 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 very good friends, Tay Holmes. Congratulations. Yeah. Yep. And I'll be seeing them in Nashville in a few weeks. So looking forward to coming down there for that engagement party.
Yeah, we're looking forward to having you out here.
Yeah. Yes.
Yeah.
So,
Let me go. Let me go and tell this guy who texts me who that is. I say she taking.
Yeah, she did.
All right.
Very, very good conversation. And
Yes.
and what I will say is, and I'll just tell a personal story. I say one of the things that motivates me is fear. Fear can be a really good motivator. And I think when you start to have children and you want to be around, you want to be around them to see them grow up, to see them have kids. So I would tell you that having children and the fear of not being there is one of the things that definitely propels me, even though I'm retired, to keep working out, to make sure that I stay in shape, to do all the things that I can do so that I can be around. And so for the people who are watching and for the people who may be watching again, find out what motivates you, write it down, write a goal, and take steps so that you can work on your wellness and your mental health. That's all I got. All righty. Well, thank you all. Have a good night, and thanks for all the people who are watching.
All right. Thanks a lot.
Right.
Night. Night.
Thank you.
All right.